You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
You're back with American Medicine Today. I'm Kimberly Brumell, joined by Ethan Euchre.
Glad to be here.
And Jeffrey Wagstaff.
Howdy, howdy.
And world-renowned orthopedic surgeon, Dr. Alfred Bonati.
Hi.
Hi. So there's a new smartphone app called Peoplescreen, and it could help detect concussions and other brain injuries in the field, whether at a sporting event or on the battlefield. And joining us right now to discuss is Dr. Melanie Fletcher, a concussion expert at Integrative Concussion Therapy in Dallas. Thanks for joining us, Dr. Fletcher.
Thank you for having me.
Now, with concussions, specifically sports-related concussions being so topical these days, this is actually pretty incredible technology. Tell us how Peoplescreen works.
So it's actually an app that's still under development, but currently it is very accurate in detecting a severe injury.
Okay.
They're actually saying they need a little bit more continued research on detecting more mild concussions, which are more prominent on the sports field or in sports arenas. But it's kind of, I'm on the fence. It screens both eyes simultaneously, which is concerning to me as far as its accuracy of pupillary response. There's a reflex that when you shine a light in, say, the right eye, the left eye is also going to react in that light. And so currently the best practice is to assess each eye individually and actually wait several seconds before that pupil in the opposite eye relaxes so that you can have a more accurate test.
Okay.
And that's going to detect those more milder concussions if you do a single eye test. And so I think that's where their continued research is going to really look at how sensitive they can make that.
We should also just point out real quick that Dr. Fletcher
She's not
has no
affiliated.
affiliation
Yes.
with Peoplescreen. She's just an expert on concussions.
Correct.
That's why we had her on to break it down for us, whether it's useful, whether it isn't.
Right.
So.
And you were starting to talk about results, but how accurate is it? Because they did an initial small study of 48 people, and they had nearly perfect accuracy.
But that's in a more severe injury.
Okay.
And so with more severe injuries, the pupillary response is directly related to brainstem challenges. And so in those severe cases, you have things like acute brain bleeds, where that pressure is going to change very drastically. The inflammation, the swelling that occurs in the brain is going to kind of happen quickly. And so an initial pupillary exam is going to show a lack of reflex or a lack of pupil constriction. And so when you have a more mild injury, it's actually very important that you do these serial neurologic exams where you're looking at balance, you're looking at cognitive impairment, you're looking at these pupillary responses, every, 15 to 20 minutes up to hours following the concussion. An acute subdural hematoma, which is considered a severe injury, can actually have a slow bleed. And where it happens in the brain, it actually can take some time before it causes some pressure. And you won't get a neuro change, a pupillary response, until hours after the hit. And that's a very high mortality rate. 50% of those subdural hematomas end in death.
I have to jump in because when you have a technology like that right there on the sidelines, I mean, is it better than just asking the would-be injured party if they feel okay to continue with whatever activity that they're in?
Yeah, because the current protocol is really pretty sketchy in the sense of they pull a player aside, and a player wants to play no matter what, especially if the game's on the line.
Yeah.
They don't want to let the fans down, don't want to let the coach down, and the coach just says, or the doctor or whomever, asks them a few questions. Where are you? What's your name? What year is it? Blah, blah, blah. They answer them all correctly. They say, do you want to go back in? Are you good to go? Of course the player's going to say he's good to go, but he could still have a severe concussion. No way to tell.
Exactly. There is a recent study coming out of Penn State that 75% of athletes underreported concussions during games, especially a game that they were winning because they wanted to be back on the field. And so underreporting is a huge issue. And in doubt, the coach needs to screen them or the athletic trainer needs to screen them. I think tools like this are great for, one, those players that aren't reporting, and two, especially in club sports, because there's no medical professional required to be there some are there during tournaments, but even during tournaments, it's kind of spotty. It's not required by a lot of the facilities. It's up to the facility to provide that medical management. And so, and in defense of those coaches that don't have any education at all as far as sideline assessment goes, something like this is going to be great if they can make it more detectable for those milder concussions. Because if you use it as a sole standalone screen and it's not sensitive to those mild concussions, then you're putting that kid at 6 times higher risk of getting an injury by putting them back on the field or on the ice. And so it can't stand alone.
So, yeah, that's pretty much what I wanted to get was your professional opinion. Obviously, as you mentioned at the top of the interview, it's still in sort of the research phase. They have been testing it. How far does it need to go before it's available for the general public or just, doctors? It could be used on battlefields, things like that. How far do they have to come before it's accurate enough?
They're actually projecting 2 years to get enough data. And that's going to take a lot of tweaking. Like I said, if they really want to get sensitive, they're going to have to go to a single eye approach. And right now they just have kind of these goggles that block out, lighting in a 360 with a smartphone kind of positioned in the perfect place. But that doesn't single out either eye. And so maybe they're going to play with the design of the actual goggles that they put up to make that information more sensitive. There's not really very much information out there on how they're going to tailor the current design to be more sensitive, or if they're looking at that. But when it comes to sideline assessments, we have to, you see this in professional sports now, they keep them in the tent for maybe 10 minutes and then they release them back out on the field. You have to have that serial exam. And you have to keep them pulled, especially cognitive, especially amnesia issues are very common in boys compared to girls. And
makes sense.
All the time I have my soccer guys come in and tell me I was watching film the next day and I didn't even remember making the last 2 goals of the game.
Wow. I hear about that a lot, not to interrupt Dr. Fletcher, but I hear about players that take a big hit in the third quarter. In the post press conference, they don't remember the fourth quarter at all. And fighters in MMA, they'll get their bell rung in the first round, go 5 rounds with somebody, at the end, win the fight, end of the fight, they don't remember anything after that.
How is it they were allowed to play, though? How could they either answer questions properly and not remember the... I don't know.
Well, it's like, it's just like when people are blackout drunk.
Yeah.
If you're around them, and I've been around people like that, they appear to be drunk, obviously, but they can still talk. They can answer questions. They can hold a conversation. You talk to them the next day and say, hey, remember when you told me that? Absolutely not. They don't remember any of it. They're just not laying down new memories. Right. So they can answer questions, right? And
I think there's a huge misconception about you need to have a loss of consciousness still to, have concussive injury, and that is completely false. Right. And so a lot of our lay coaches that are especially lower level, coaches, they don't understand the impact of a concussion on a growing brain. You're so much more susceptible under the age of 18 because of the mass of your brain compared to your skull and the fluid around it. Right. And so, especially in our younger kids that are having all of these concussions so early, it is not uncommon for me to get a 13-year-old that has 6 concussions because they've been playing, ice hockey since the age of 5 years old.
So scary.
I think we're discounting our falls in our elderly population. They're at higher risk for concussions than our youth are. A lot of people discount their younger toddlers falling and having, falls from, the diaper changing station. That's true. Falls off playground equipment, and they're not screening them for concussion. They're not even taking them to the ER.
Yeah, it all adds up. That's for sure.
Yeah, no sport should be injuring our children. It's certainly not worth it. Thank you so much, Dr. Melanie Fletcher, a concussion expert at Integrative Concussion Therapy in Dallas. Thank you for being a testament to a new smartphone app called Peoplescreen. We really appreciate it.
Thank you, ma'am.
Have a good one. Bye-bye.
Thank you.